All right, everybody, we're going to go ahead and start our meeting. So I'm going to call the meeting to order. And we will start with roll call.
All right, Chair Dr. Amber Donnelly.
Here.
Vice Chair Nancy Bowen.
Here.
Stacy Week. She is running a tad late, but she'll be here, so we'll mark her here when she arrives. Vance Farrow. Here. Michelle Sandoval.
Here.
John Pichon. John Pichon. Becky Bailey. Here. Gerald Ackerman.
Here.
Dr. Marcia Turner.
Here.
Dr. Shayla Holmes. Joseph Westerland.
Here.
Noel Shortay. Sorry.
Here.
Thank you. Josh Cabral.
I'm here online.
Thanks. Thank you. Sean Pena. Okay, and I just saw John Pichon walk in, so I'm going to mark him here. And one other call for Sean Pena. Okay. And Dr. Kayla Borgo.
Here.
Perfect. We have board.
And if we can start with public comment, the remark on public comment, and if there are any public comment after that.
Perfect. All right. So public comment. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person. Persons making comment will be asked to begin by stating their name for the record and to spell their last name. And at this time, I would like to call for any public comment. Please feel free to use the raise hand feature in the Teams platform and unmute yourself if you have public comment.
Is there any public comment here in the boardroom? No public comment. And online?
No public comment on the board.
Seeing no public comment, we will move on. So just some opening remarks. It's been a crazy couple of months. I want to start off by thanking Jason isn't here today, but him and Melinda, their entire team. You can imagine this has been a huge lift. I understand that the application process and how many applicants they received just even in Flex Fund was very, very large. And so going through all of that, we just want to say thank you and appreciate all the work. I know it's probably feeling like a little bit of a thankless job because of, I figured that that was what was going to happen. A lot of applicants and it's going to seem like $3.50 that you're trying to spread out, even though it is a very, very large amount of money. So we just, we know it's a lift and want to recognize you and their team. And as you go forward, any comments that anybody has to make today, make sure that they are constructive and in no way punitive towards their team. And I know that there probably isn't anybody here who hadn't been contacted from somewhere wanting to do partnerships. And so I've never seen more of an outpouring of support and help for rural Nevada, having lived in rural Nevada my whole life. It's really exciting to see the opportunities that are going to happen across rural Nevada. And over the next year, we'll get a chance to see what that's going to look like. So with that, we'll go right in so that we can hear all the good reporting and all the information, and looking forward to hearing what everybody has to say as well. So we're going to start with our information item, introduction of new staff, which you guys all have.
Perfect. Thanks. So we'll have Alicia and Dina.
All right. I can start, but one of my staff members is actually attending another meeting with me today, so I'm just gonna make it quick. But I do want to introduce Paul Humphreys at our, he's serving as our management analyst 3 on our fiscal team. He's been amazing. hopefully I'll get to introduce you to Coral just a little bit later today, so.
I'm Dina Schmidt, everybody knows me, but I would love to introduce you to the people behind all of this. These guys have been working their tails off, and I appreciate the much experience that each one of them brought to this process. So I'm gonna let them introduce themselves, but we'll start with Raul.
Hello, everybody. My name is Roel Bencourt, the new management analyst for Wolf Tank HA.
Bernadette Demar.
GPS signal lost.
Those three. Dan Guzman, that's the Atlas Three, and all the health preservation projects. Nice to meet you. My name is Cassandra Colbert, and I'm at the Alice Three.
Then we have Evan, who is not with us today. He's remote today. But yes, that's the team, and we still have 4 more positions that these guys are interviewing for this Thursday and Friday that we hope to fill in the next 2 weeks. And those positions will be our MA2s who will do the day-to-day and you'll grantees will get to know.
Well, thank you and welcome to the team and welcome to the lift. This 5-year process. So with that, we'll go ahead and start with our item number 5, which is our Nevada's Rural Health Transformation Program and Fiscal Activity Report.
I've got a presentation for you all.
What's the best practice?
Oh, I tried to use it, but I can't get out. You know what that is?
And me requested.
Oh, dollar sign. Dollar sign.
Not being rude, I'm just gonna go on.
Oh, you're fine, yeah. Yeah, you get it into presentation mode. That's better.
Oh, you're fine, you're fine, you're fine. Noel, if you want to turn around, you get to it or.
Turn it over to Dina and Tina. Me to go to the next slide?
Yep.
Please do.
So we're gonna go through, I'll start, and we're gonna go through all the program activity we've been up to lately. I'm gonna give you some updates and answer any questions you might have. So let's get started. First is our team, which we just introduced you to, but this is kind of our structure on the programmatic side. Just so you have a sense of where everybody fits in the cube. So what have we been up to? We have obviously been developing and publishing RFAs. We've now done 10 RFAs, as well as set up review committees, trained our review committees, set up evaluation meetings. So we have everything scheduled through July for all 10 RFAs. And we're still gathering people to sit on some of the evaluation committees. So if you know of anybody who's not applying that might be a good fit for some of our evaluation committees, we're always looking for some help. So that it's not quite so overwhelming. As somebody mentioned earlier, the number of applications did make the review committee work a lot more strenuous than we anticipated. So our team had to step in and do some of that work as well. So that was more than we expected.
Do you have something for this number of slots for the committees that you need to build in for the share folks?
I can tell you for right now that the committee that we're most lacking participants in is for the RAP Rural Workforce Project. So it's that rural GME portion of it that we're really looking for evaluators on. So if you know of anybody,
Absolutely.
perfect.
Just less than the 2.
You can just send them to me. It would be great. The RHT inbox. Okay, perfect. Yep. The next, community and stakeholder engagement. As you all know, we are trying diligently to communicate as best we can, make sure be transparent and provide updates. So we've hosted several workshops and webinars and done public presentations. We do meet with CMS, continue to meet with them bi-weekly to get many of our questions answered. And then the emails, we do answer a lot of questions via email, and you see those Q&As go back and get posted on the website as well. So those keep us busy. And then in the meantime, we're also developing our policies, procedures, guidelines, templates, and looking for technology solutions for budget period 2, how to make the whole process a little bit more streamlined using technology is one of our big goals that we are focused on as well. And then in that same vein, we're planning for budget period 2. We do have to turn in our application. We'll talk more about that later today. And what subrecipient monitoring is going to look like. We're working with our team and CMS on our reporting metrics and refining those a bit. And so that's another project we're all involved in. And then what does technical assistance after grants look like for subrecipients? We're doing some planning around that. As well as some education webinars for subrecipients. We were thinking about some collaborative and educational opportunities that we'd like to provide once we get a little farther down the road. So here's all the listening sessions that we have done. We did general listening sessions. We did activities focused on each of the RFAs, sometimes 2 or more. Just really wanted to make sure that applicants understood the process, the requirements, and what we were looking for. And so we have had wonderful attendance. We've had nearly 100 plus in almost every one of them. I think 70 something is the lowest attendance we've had yet. So great outpouring of participation in those engagements. So to give you the big picture, here's kind of our flex fund closed, and we made decisions. RAP, we call it number 1 and 2, which is our recruitment and retention and apprenticeship and training did close. We have met and made our recommended decisions, but we won't be sending out official decisions until June 15th. So we have till next week. We're finalizing budgets right now and tweaking some things to finish up the budget, and then we'll be making those announcements next week. And then right behind that, we have the tribal health applications are due, and we'll be meeting in the next 2 weeks for that process. You can see there's 629, but I imagine we didn't have the number that we expected under tribal, so we should have those decisions much sooner than that date. And so we'll just work through those as we go. Veterans and Corrections, we are working with both of them. They've turned in their applications. We're tweaking them and working with them on their state LCB processes and how to get their work programs through before they can take their funds. So slowly working through those, as well as the schools. Same idea. The schools have until June 1st. And then we have until July 15th to give them their decisions. And then the IT has until July 6th. Applicants can turn in their applications, and we'll have decisions or letters of intent, I should say, out by August. And then our last one, RAP number 3, also closes in June, but decisions will go out in August. So that gives you a sense they're kind of overlapping, and they just keep us going.
Keep going.
And we're all taking vacation in August. I told the team no vacations until then. So here's some updates for you on what we've received so far. So under our flex funds, we had 35.9 million available. We did receive 103 applications and $180.6 million in requests. So as you can imagine, there were lots of unhappy applicants just because of the nature. So on our recruitment and retention, we had 14.3 available. We did receive 35 applications and $33 million in requests. So again, an incredible demand, which is great to see the interest. And on the apprenticeship and training, 32 million with 39 applications and $44 million in requests. And then tribal health, $8 million available, 6 applications and $11 million in requests. So a lot of interest in these funds. So the one we are able to give you an update on, and this is available on our website. We are, as we issue letters of intent, we will be keeping our website updated with announcements who gets funded each round. So these are the projects that were funded under Flex. And again, you can look it up on our website, but all the rural hospitals received funding. Most rural hospitals, I should say, and then one did not, because they were our top priority. So that was, so those were all funded, and 100%, if you want to look through, go ahead and scroll through here. The nice part about on the first round of flex funding is every applicant was a rural provider, or yeah, so there was no outside entities. It was 100% rural providers that got funded. Lots of equipment. There's going to be lots of projects coming. And just to give you an idea, we did create this, and this is also on our website, but it gives you a sense of how we spread the funding. We did try to make sure that we spread it as far and wide as we could, and that we were hitting all the rural communities as appropriate. So next steps, we will continue to go through the process like we are now. We present to the director's office each time we have a round of applications, and once those that decision is made, we send out letters of intent to fund, and then we work with the applicants and CMS. CMS does require approval on items over $10,000, equipment over $10,000. So we are trying to get some more clarification on what that process looks like, just logistically. How do we upload information to them? But we're hoping to have that process started here pretty quickly. Some applications will require CMS approval before we can approve the subaward, some will not. So it'll be a little bit different depending on what the application is for. And then final negotiations and getting those sub-awards finalized. We have until October 1st, but we're hoping to have those done prior to that, by all means, and getting everybody their sub-award notices finalized. That's it on the program side. I'll turn it over to Alicia.
Great. So just wanted to give you a few of the highlights, what's happening on the fiscal side. We were going to go ahead and, again, touch on our fiscal team, just give you an overview of the spend plan for this budget period 1, and then a financial overview of where we are as of this week. Again, that's our small but mighty team, and hopefully you'll get to meet Coral a little bit later today. And Paul, I did not give you an opportunity to introduce yourself, so if you'd like to do that very quickly.
All my degrees, I've been with the state a couple of years, about 3 years. Before that, Penn State University, a Coast Guard career, a lot of fiscal stuff, grant training.
All right.
Not telling you. Sorry.
He's holding back. He's great supposed to do. All right, so our overall spend plan, I broke this out a little bit so you could see how we're looking at it, because as you know, our RAP program was over 70 million, but we do have it broken out in the 3 different categories. We've got the recruitment and retention program, which is about 18% of our spend plan. We've got the RAP provider and apprenticeship program, which is about 8% of that plan. And then, of course, our RAP, the provider rural medical residency program. So that's about 14% of the plan. The RHIT is about 15% of the plan, but this just gives you an overview. I mean, Flex Fund was 20%, and you can see that based on the information that Dina just shared, that there was just a huge demand for that. So what'll be interesting is going forward, do we make any adjustments to that in some of the next budget periods? So those are the questions we have to start to figure out how to answer as we go forward. Couple notable items here at the bottom, just, our administrative costs, we've tried to keep them very low. They're only about 2% of our budget, and we're definitely staying within that. The purpose of this program is really to make sure that all these major initiatives are fully funded. So that's our priority. Any questions about, I mean, I know you've seen some of it, those questions or concerns. Yeah, go ahead.
Question. I was just wondering, from a logistical standpoint, was there any direction with regard to, in terms of a round 2 worth of funding, that we had to be at a certain milestone with regard to encumbering funds, or is it, what sort of is the if then that ensures that round 2?
So we'll talk about this a little bit later, but it's, with the non-competing continuation application that we have to submit every year, we, report out on our milestones, all of our progress that we've made on our metrics and everything. And some of those are scored and go into, the funding for year 2. So,
Okay.
yeah.
Okay, and then, we want to go on.
Yep, there.
All right, so this is just a snapshot I wanted you to see. So we've broken out, we'll be providing updates on this. I think the next go around, we'll also provide some updates on all the encumbrances, because as you know, or you may not know, but as of October 30th, all administrative costs for VP1 are spent, and that's all we can spend. And then we start on VP2, but all of our subrecipients have the remainder of that time from October 31st through the September 30th to get, or according to the applications, October 30th, so that we can get all of the spend actually sent out to them and sent to CMS. So what we want to do is just make sure that we're tracking both what has been actually spent to date and then also what's been encumbered. And so we'll keep you up to date on that as that changes. As of right now, you can see that for all the work, there's a lot of money that needs to move the next few months. So we've got, so we're glad that everybody's working so hard. We've got, I think, as far as, as I said before, the administrative costs are the only ones that we have to have fully spent by October 30th. Everything else we've got till September 30th of 27 to fully expend. Yes.
Nancy Bell. You're optimistic you can spend 3.3 million and what is it, 4 or 5?
I would say that a portion of that is already fully expended and they have, we are managing to that. So,
Because you can't carry it over, correct?
we cannot carry it over past.
I just don't want it to them to go, oh, well, they don't need that much next year.
Trust me, we're doing
I
everything
know.
we can to spend it all.
It'll be like October 29th.
Right.
Yeah.
We have resources that are been supporting the effort of getting these RFAs out and so forth. So, we anticipate having majority of that spent. So, but good question. All right, and I will hand it back to Linda.
That was it. Any questions?
Anybody have questions in the boardroom? And anybody have questions that are part of the committee online? Sorry, Gerald.
This is not a question, but at our state, National Organization of State Offices of Rural Health, we had some representatives from CMS there who came and talked about rural health transformation, and they specifically pointed out Nevada and the progress they had made and how far ahead they are. There are states that don't even have RFPs. They're so far behind that they specifically called out Nevada and said, what an awesome job Nevada is doing. So I just thought I'd ask, it's nice to hear good words.
Very nice.
Yeah.
Thank you. That's wonderful. Appreciate you sharing.
Great. Anybody else on the committee?
Can I say one more thing? This is not on the agenda, but NRHP and we have been having some conversations about our Nevada Rural Health Day that we do every year.
We can add that to the end.
Okay.
There's a spot down
It was
there
just an
where we can
educational,
just
it
add
was just
additional
an educational piece. So, okay, we'll put it on the end.
on the additional topics.
Okay.
Okay, so we're gonna go on to our item number 6, which is the RHT request for application for RFA process improvement and lessons learned.
Perfect. Okay, so that one again, I'm gonna share my screen. All right. For this one, we just wanted to talk through, we've had our first RFA open and close, and have, issued those letters of intent to fund. And just looking at all the other RFAs that we have out there, we're really interested to hear from the steering committee members, ideas on how we can improve that process, how we can potentially make things clearer, and, communicate better to the public on these different opportunities. So really looking forward to hearing from you all, how we can do that better.
So we'll go ahead and get started. Oh,
Wrong button. All right, so we'll just do a quick overview of the request for applications, and then, we'll get into some discussion. All right. Okay, sorry. Okay, so as we mentioned before, our RHT team published a total of 10 RFAs for budget period 1. Some of those RFAs were completely done by our NVHA in-house RHT team, and some of those we did have some help from some outside vendors, which was amazing, of course. And for these, we did have some of the initiatives were originally proposed to be solicited as requests for proposals, so the RFP process. And through talking through that and deciding on, the different types of applications that we wanted to receive, the different types of projects that we wanted to fund, we found that it would be much better if we could just do that as an RFA instead of an RFP, and it would allow a lot more flexibility in, the types of projects that we were able to accept through that. So we were able to work with our federal partners and quickly pivot to doing an RFA for all of our funding opportunities. So I thought that was really cool. So just a quick overview of the RFA process itself. Like as I said, the team here either developed the RFAs or worked with the consultant vendor to develop those. We also had to develop all of the attachments and the templates, and all of that went through several rounds of review, as you can imagine. Then we worked to, publish all of those documents on the webpage, made sure that we had those announcements go out through the listserv and, all the different avenues that we have available to announce those things. And then after the RFA was published, we worked on developing a webinar to kind of walk through the RFA itself, give some kind of technical assistance on different sections of the RFA and offer some more clarification on maybe what those different sections meant. We took a bunch of questions from each of those webinars. So for each of our RFAs, we tried to do one webinar for each RFA, at least one webinar for each, to provide that opportunity for public feedback and input and to allow people to ask questions. And then in addition, we also have our Q&A document that's published with weekly updates on all the questions that we've been receiving about our RFAs, and just, because once somebody asks a question, it's really valuable information for somebody else to hear that response. And so we thought that was very strongly, we want to be transparent and clear and, give that guidance to folks for the application. So then we move on to our evaluation and awards. So we have to, for each of these RFAs, we have to assemble an evaluation committee. And the members of the evaluation committee obviously cannot be applicants themselves or affiliated with applicants in any way. And so, as you can imagine, sometimes that was a little difficult to find folks to sit on that evaluation committee that didn't have that affiliation. But we were able to use our team members here to help to fill those gaps. But as Dina had mentioned too, the volume of applications received is so intense at times. It's a lot on the evaluators to have to go through that. So it's nice when we have a bigger group of evaluators to where we can kind of break it up to where not everybody has to review every single application in depth, but they are responsible for reviewing, a core set of applications. And then they get together as a group and discuss the whole batch. So working through that process, also have to, of course, allow a lot of time for the evaluators to get through the batch of applications. So building that into our timeline and then having that meeting where everybody comes together and makes the final recommendations and then present that to the director's office and then get moving on those letters of intent to fund. So it's a lot involved in the process, but we're working on it, getting it to be, it's going to be a well-oiled machine here pretty soon. Okay, so now I'll hand it to Tina.
So we want to know from your perspective, right? We have our list, obviously, internally of things that we think we'd like to improve, but we really need to make sure we're listening to the people that are impacted the most, and that's you all in the community to represent. So we have a few questions that we want to go through and talk about what went well. Right? How accessible and clear were the announcements? They would like, did the RFA material communicate the full purpose? Did people understand what we were trying to, the types of initiatives we wanted to fund under each of the RFAs? Did the open RFA announcement reach the intended audience, and did it do that in a timely manner? So those are some of the questions we have for you regarding accessibility and communication. Did we communicate well, and did it work? Yes.
I think the workshops were great. And it was a great way to, if you had people on your team that were tracking things, to send it out, make sure everyone watched it or could go back and watch it. And you guys just anticipated all the questions. I think they were all really good.
So
You can would just say your name too for the record.
Oh, sorry,
Marcia
Marcia
Tucker.
Tucker.
It just helps. Sorry.
Dan Farrell. I'm not sure if this was just people being people or if there was anything to this, but I found that I would get the notices, which I thought, everything's working the way it should work. You sign up, you're on the listserv, you're getting the emails. It clearly explains what everything is. And yet people that I'm literally driving to the website and saying, sign for the listserv, you're getting that, and I'm steadily getting calls. Do you know when this is going to be? Do you know when this is going to be? And I'm just like, are you really signed up to the listserv? Did you really get? And then I'm forwarding these things out, and they're like, oh, thanks. So I don't really know what the answer is to that. I don't know if it's sending those notices out maybe twice or 3 times per notice, which, I mean, I know everybody gets a ton of email anyway. I don't know what the answer is, so I just kind of put that out there, but I do have a question.
I'm sorry, this is Stacy. I think Vance, I hear you. I get, Dave, I get 1,000 emails on this a day, and I'm like, sign up for the listserv. I think a lot of it too is when our website has been kind of in progress since the cyber attack. I'm just gonna call it in progress. It's still in progress. But I do think that's part of it is when people are looking, I tried to Google RHG the other day and the link was dead. So I think we've got to take that back and work with Chloe to make sure RHG Nevada pops up. So we'll work on that. And the first thing needs to be the latest notices here. You know what I mean? And maybe we can work with the governor's office on making sure it's prominent somewhere on their website. You know, where people are trying to find stuff, I can't find it either.
Yeah.
So I hear you, it's a frustration of mine too, but I think, I'm just gonna say, everything's in progress, but I think this one we could probably solve with Chloe. Just on search
Oh, I
engine
love it.
stuff. you
Sure.
know. So thank you for raising that.
Perfect. And then
It's an ongoing thing.
answer again, akin to what you were just saying, would it be helpful if aligned departments and agencies within the state were amplifying the website with additional links, whether that was Peter or our office, GoEd, or any of the other, as they pertain to the categories of funding? Just a thought to utilize that as well.
Thank you. I'm trying to make sure everything that breathing. So Vance, I think maybe we could use your help in that too.
Okay.
If we can talk to some folks about who would be love, times, you know, reaching out, like who can help us lead that?
Okay.
You know, so maybe help, let's talk to Lindsay and others, the governor's office, I think a couple key other websites, like redirect them to us,
Yeah.
would be helpful, yeah.
And then my last question, and I don't know the answer, but I'm just wondering if this was available for all of the workshops that were done. Were those available on demand for people that couldn't see them in real time?
Yeah.
They were, okay, perfect.
Yeah, because there was a couple, Amber Denelli for the record, there were a couple meetings that I wasn't able to make and I went back and watched them.
Oh, perfect, perfect. Thank you. Well done.
Tom Sean. One thing that did go well, you guys kept the application very simple and easy, so that made it easier. For my grandson, I mentioned that to me over and over, that was one of the, made it a lot easier than some of the federal applications that we've got in the past. So made it so much nicer. The other part I think was good is the outreach. I mean, the public workshops are good, and I know you guys also helped us out attending some of our health records. So I think that outreach is probably the best thing going forward, if we can continue that going forward and keep the application simple.
Sheila Holmes, for the record, I just want to say that all of the partners that I was working with found you guys to be very responsive. So any question that they did have, any clarification they did, when they reached out, they got an answer pretty quickly. So I thought that was fabulous. There were some links or some attachments that were clear for some of the applications, but others that were just like images or screenshots. I think the budget was one, but I was like, oh, I bet it's the same screenshot as this budget, just go use this budget. Highly likely that had they have reached out to you, you would have responded to them within a day anyway, but I think they submitted with that budget and I think they were approved either way. So I think you guys are just pushing out so much at once, like, you know, that makes a ton of sense as to how that happens. The only thing that I would, and I don't know how you fix this, so that's not helpful, but a lot of partners that I've been talking to about this were unaware, which I found amazing. Like, how are you unaware? But I think too, because they're not and most of folks that I work with, and the further out road you get, there's not a lot of direct health. So you guys did a great job at nailing and providing funding to a lot of direct health partners, but there's many that would probably be able to expand and do more and hit some of these outcomes. But they're like, oh, we're not health. Like, we don't have doctors, we're not health. So they weren't even considering themselves as a possible applicant. So I don't know if there's like other keywords that could be utilized. I don't know how you address that, but I had to sell some folks. And it was like, no, if you look at the application and like read it with them and digest it with them, they're like, oh my gosh, yeah, we totally do that. I said, yes. And you could do that more targeted here, and really expand. So just some consideration in the future.
We should do, sorry, maybe what we should do is a sort of workshop that's really about, you know, which grant should I pick, more education, or maybe this is where we need to talk about a technical assistance vendor that works with communities to help them figure out if it's the right path. I think year two, we are hopeful to open it up more than just meeting the basic needs of the system infrastructure now to really look at some of those extra programs that we've been talking about. So helpful feedback.
It's a notion I would share and add on. I think a lot of people, like their definition of health in general is just very narrow. So if there's a way that we can kind of redefine it or expand upon that, I think that could be helpful. Because we do, to that girl's point, we just think of going to our doctor or our nurse or our.
I got some. Joe Westerland, Tonopah. And when we first started this, like I said, I got a phone call from a friend of mine and they asked me about it. And then I started making phone calls. One of the coolest things I heard was a couple of days ago, a lady named Ann Carpenter. She called me and said, "Hey, Joe, I was in the Belmont bar last week and there were 5 people in there. And that's what they were talking about was this grant."
Oh my goodness.
And I thought, really? And they were excited that Tonopah's clinic might open up. And I think the first year it was probably tough to get it out, but I actually called Beatty and they hadn't heard about it. And so I and I was talking to Gus Sullivan on the way down today. He was asking me if we had heard anything. And I think once this first round of money gets going and things start opening up in the rurals, they're gonna say, wow, how'd you guys get the clinic open? That word spreads quickly. And then they wanna know, we're gonna maybe get expanded dental hours and Goldfield and Silver Peak and Fish Lake and all these little places that have never even thought about having medical are going to now have access to something. And so the word's going to spread, I think, after the first year like wildfire. So excellent job, though.
Vance Farrell again. Wondering if I call it a lull, dare I say, but also incorporating other partners like the Nevada League of Cities. Because I think that where you have all of those municipalities and representatives of those municipalities coming together, I think there's opportunity where they can, again, stretch those funds with other assets that they can bring to the table as they address health from their perspective, for some innovative and more creative partnerships on the next rounds of funding. That might be something that we could expand our engagement with, because I to your point, I would hate that a municipality is just kind of head down worrying about or dealing with their own 6 inches in front of their nose and this goes right past them because they didn't know or nobody told them or they just didn't have access to that information. So I think if we engage those organizations and at least have them, maybe pull them into the conversation or even the Association of Counties or however that breaks up, but I think that having them on board would be good to expand that reach.
Becky Bailey for the record. I just wanted to say that if you have the website memorized like I do, this is very, I think everything is set up very clear, very accessible. I'm getting all of the announcements, but I am also getting texts right now that confirm what Stacy said about if you Google it, it goes to
They just.
I think the old.
Yeah,
Is it
this is Stacy, they just said the governor's office updated, there was something, so it's one of those things we got lost, so they just fixed it. Back. So they're working on it, yeah. So I'm still, they're working on it.
Still not bad.
But we're also gonna move that button, click here for to keep updated at the top, so Chloe's working, Chloe's listening, so. Thank you, Chloe.
And I just wanted to say that the core purpose of the initiatives, the only issue I'm seeing, and I think Stacy touched on this as well, is that overlap between the different buckets of which one do I apply for. So maybe like some examples of how to choose which one's best. We have a question online from Sean.
Yeah, can you guys hear me?
Yep.
All right, perfect. Sean Pena, one of your guys' committee members, but I wanted to kind of just directly address your guys' questions that you guys brought up and just give a little bit of that praise. As far as accessibility and clarity, this is the first grant actually that I've ever even looked at being on a committee like this, and it has been very, very clear for me on the application side, on the committee side as well. And I do believe that as a member of the committee, it is my job to also fill a little bit of those gaps in my area. And I think that's why you put us in these places as the committee members. So as the gentleman was speaking earlier, he's getting those emails asking for, hey, where do I go for this? Where do I go for that? I received that a lot here in Eastern Nevada. And, I look forward to those conversations. It's helping me to outreach with other departments and things like that. And so I think that a little bit of that is actually part of what we are supposed to be doing. And so I think you guys are sending out all of the information that I need in order to be answering those questions. And where the information I've been struggling with, I can't believe how fast your guys' response times. I can't imagine what kind of emails you guys are getting with 103 applications in the very first section. So I imagine you guys are getting quite the questions, and you guys have responded to me very quickly for all of my shortfalls and mishaps where I just don't know exactly what I'm doing all the time. But so I think you guys are doing an excellent job. I do also think in the future, so for next year, right? And I guess I'm kind of thinking a little bit far ahead, but with that, we won't be. Are you guys going to be continuing to hire new people for that, or are those positions for those committees and everything set in place just like our committee?
For the evaluation committee?
Yes, sorry, yes, for your evaluation committee.
Yeah, we actually hadn't talked about that, but I would imagine, those can be fluid. I don't see those being, set in stone at this point.
And the reason I just bring it up is because I'm imagining a time frame for this first year has just been really, really tight for everybody. And that's just because of the nature of what we're dealing with. And so I imagine that we're going to gain time by not having to do so much of this initial process. And so with that, I think that if we gained a little bit of extra time for, each and every different step of this process, I think it's going to help as well.
Yeah, agreed. Thank you.
Gerald.
Go ahead.
So my thoughts were along the same lines as Vance, but I think one of the things maybe is really educating the county commissions, because almost all of those unincorporated areas that can be influenced and impacted by this set of funding have to go through the county commissions. So they have advisory boards like Jackpot and all those unincorporated areas. And it would be really good to maybe put an informational session together. I don't know, maybe working with Nevada Association of Counties to reach out to those unincorporated areas to maybe do some stuff with them. I know we've been working with one community, and we keep mentioning this fund, and they're nervous to go to the county commission. So that's their biggest issue. So somehow getting the county commission, and especially on the fiscal stuff, how it works, because that's, I think, where most of their questions, or at least one of the hearings I got to sit in.
Would it be helpful to put an informational item in local newspapers?
Well, I don't know how many people take the local newspaper anymore. I think in some communities it's still good, but ours is out of Twin Falls. I don't know hardly anybody that takes it anymore. So
Amber Daly, for the record. I would also just say, the other part of the county commission and the hearing that I sat through, all of these have to have some sort of sustainability. And so the other piece is that people are like bombarding them with ideas, and they're like, okay, but then what? And if you're looking at us to pick up the tab, it's kind of like, well, how are you going to make the money to do this? So it's not that they don't need the resources, that they need something in there. The plans for sustainability and how a project can be carried forward has to be pretty well presented with a strong understanding that the county commissioners are not just going to all of a sudden have the county be on the hook for whatever you guys awarded. And so I'm sure that like, particularly with our county, those were some of the questions that came up. So it might be worth giving a presentation that yes, if there is something that you guys are looking at that would require county support going forward, that those are things that definitely would need to be heavily weighed by county commissioners. So I imagine that in any one of you that, you know, would have that tied to it, that they're looking at how you're gonna generate the revenue to carry the project forward.
Jim Holmes, I would just add, you guys did a fabulous presentation to the Nevada Association of County Organizations. You guys did come out. A lot of commissioners were present and there for that. Or interim director Amy Hines Sutherland is fabulous. I say for because she's stuck on the phone with me probably every day. I know that she is very dedicated to health and human services, and she is working very closely with many of the counties that are interested, as well as putting together an application from Nevada NACO to try to find a way to be able to support counties in this, because some of our smaller counties do struggle. Every county per NRS is to have a board of health. But not every county has the capacity or ability to do more than what is required by NRS. But those counties don't have oversight of their community organizations. So those community organizations are able to put together an application with or without their county commission support. Only if it was going to be a county operation would the commission have to have approval. But some counties are poised to do that, but Nevada NACO is absolutely aware, on board, and engaging in that conversation. Can't speak on behalf of League of Cities, but I know Nevada NACO is 110% there.
Sean, quick question for the state officials. When you guys did all these webinars and all this stuff, all the meetings, was there a group that they thought should be there that were missing? Or was it a good representation across the whole board?
Some of those meetings had like 230, 300 people plus in them, so it's hard to narrow it down.
Or maybe in the application, did it kind of look like there might be groups missing in general that you thought we might put in, or is it good representation coming across? Because that would tell you where we're missing anybody.
Great question.
Maybe one of your new data.
Yeah. Yeah, but
Ever Denali for the record, but that might literally be some capacity that you can use one of your analysts to kind of stockpile so that you can look at who applied and maybe identify any of those gaps.
Yeah, Michelle Sandoval. That's what I was kind of thinking, the exact same thing, right? Because as I was looking at the applications and where awards came from and stuff, Nine County seems to be really light on their applications. You know, maybe sort of area, like, you know, how can we reach that community more? And there were a couple other of the really frontier, smaller ones that I'm sure that we've kind of talked about, you know, love the help, but how can we support them and coming up with the ideas and applying for the application, right? And I know all of you, I'm sure, contacted by so many people like, I have this idea. What do you think about this idea? Will this work, right? And Dina got pulled into a lot of those, which thank you. But, you know, I wonder about maybe having something underneath the Rural Health Transformation Committee, not necessarily the steering committee, kind of like just a consultation group, like a few people who, when we're getting asked questions about, you know, does this apply? Would this work, right? That we could direct them to, and they could kind of, you know, staff their ideas with. I don't know.
Yeah, I think the other states we're hearing are pulling in kind of like a technical assistance vendor. So we have to stay neutral, we have to be careful. Because if we're weighing in and we help with the application and it gets funded, it may look like unfair. So one of the thoughts is we spend some of our administrative funds that year to get a vendor or some entity to come in and be that technical assistance hub to help people navigate, you know, draft their applications, build their budgets, because it's complicated. You know, it's not something we all do on our daily basis. There's some people, especially in our rural communities, so that is an option we should probably consider. And then also the other piece that other states are looking at is using a similar vendor stay on as sort of a technical assistance hub future to rural, depending on if they're good at maximizing funds to support things, or if they can help with evaluation of the program. How do you support sort of these rural communities after, right? Remember, after 5 years, we don't want it to be a cliff, we want it to be a mountain that keeps going, and that's gonna be our biggest challenge. Like, what do we need to put in place to do that?
We'll go here. It's been said several times already, but I don't mind heaping more praise on you guys as far as the response from people reaching out for help. I heard that several folks. And then just the clarity of what the priorities are, the eligibility requirements, evaluation criteria, all very clear and got lots of positive feedback as far as that goes. Wondering, now that we have funded applicants, is there going to be a way that we could maybe publish those applications as an example moving forward, where for the upcoming cycles, people could reference actual real life funded projects? Is that, I don't know if there's like privacy issues or what's
About that a little bit. We could redact, some information. But we were thinking about one in particular that was an excellent, very clear, concise.
I just think that's a helpful resource for people
Yeah.
to be able to see and model off of, so.
Yeah, even like the layout of it,
And then Gerald Ackman. So because our office got mentioned in this process, the calls like that you all have been relentless. But I think the piece that's missing here, and I know we try through our rural hospitals, but is the provider side of it, is getting some of these ideas through the providers and to the doctors, Caleb Workos and all of those folks, because they're really the end users of that product. And especially with all these AI companies, with all of the HIT, with, it is, and they're relentless. Yes. They are.
You're telling me.
But, some of them have, yeah, well, I was told that I would be morally corrupt if I didn't go with a particular project, and I went, okay, well, that's the end of this conversation. I guess I'm morally corrupt. Oh, they're all, but there are some really good ideas, and there are some internal things that I've learned about that happen in our own state that I had no clue were going on at universities and things like that. But it would be really nice to have like that provider group that could be able to meet, that they could kind of vet those things, because it may sound like a good idea to me and to a CEO, but Dr. Worko may say, I am not incorporating this into a practice because it doesn't work. And they will sell you anything you want to hear. So I think getting that information from providers, the health professional side of it needs to be a little bit stronger.
And we'll kind of just piggyback on it because I so appreciate you bringing that up. And just as a real life example, we just converted to an AI assisted EMR system. And as an example, exactly what you're saying, there wasn't a process to copy forward any of the past notes or information in the new AI models. You're essentially starting from scratch. It's like, how did you guys not think about, like, I do primary care, chronic medicine management. I need to know what we talked about last time. So, because they demo it as like an urgent care visit. Oh, so walks in, sore throat, you don't need to know any place your family history, and look how great this is. And you're like, the big hole here, guys. So I appreciate you bringing that up.
Thanks, Farrell, again. So from the state's perspective, do we have an opportunity throughout this process to be prescriptive with regard to RFPs where we see holes in our state's infrastructure, or no? And I guess my question is to piggyback on the points that were just raised. If we're looking at something like topic of HIE, example, and how things just don't communicate well with each other and this and that. I mean, it's something that could intertwine the worlds from a perspective under that umbrella. Is that something that we can say, you know what? We have the time now and the money to fix this one thing. Is that something we could attack
or do they not let us?
Dan,
Want to go?
this is Stacy. We're working on something and I prefer we leave that out of this.
Perfect, gotcha.
That's too political. I'm just to be honest. Also, fix HIE needs to be a statewide thing. If you just fix rural, that's not gonna work. And so opening up that can of worms, we're just gonna see all that money go to one. But I just want to be mindful of like, let's wait and see what we can get done next session. And if something does get better, otherwise, let's bring it back for year 3. That's my thought, okay?
Gotcha.
That's okay.
That's
There's
fine.
just a lot of, I want to be careful I say a lot.
Yeah.
I've been known to say stuff, so.
I totally get
I
it.
just want to be thoughtful of like what we're dealing with politically around some of these things.
Yeah.
There's a lot to hash out.
Okay,
Yeah.
perfect. And then my
But I
other
hear you.
point was, given that Flex had such a large response, and then I look at Tribal that had maybe the smallest, is there any concern that maybe or do you feel positive that whatever is being invested in tribal health will be able to be built on and expanded with another wave of funding? Because I don't know what the assets were for, but I'm saying you see that as with this, then this comes after that, and then this comes after that, and then with the Flex, was it a quantity over quality kind of issue, or was it just like, wow, we really got some crap? I mean, I was a training administrator for a long time, 180 million, I don't know how much of that was worthy, if you will.
I would say the majority was working.
Oh,
It was
good.
fairly difficult. We had to
That's a
rely on,
good
the RFA priorities to make the determinants that we made, right? So we had to go back to the RFA and say, look, we said hospitals are our first priority. So let's fund hospitals first before we go anywhere else.
Okay.
And let's follow that process because there was, a lot of really excellent applications.
Good.
Highly happy. So looking forward to round 2.
Yeah.
And just thinking about the questions around the application, the priorities, looking for goals. Maybe there's opportunity here in even looking at past applications if there are a lot of similar holes recognized to those applications that can help guide upcoming RFA processes too in the next year.
Justin, really quick. And I was wondering too, if looking at this first round of applications, how many mental health initiatives did we have, right? And so I think we talked about broadening what that word health is, right? To ensure that our mental health providers, behavioral health providers know that this is
We actually talked about clarifying certain, like which service having to select which services they're going to work so that we can do a better job on our data, on what services are being provided through this project. So in the round 2, that is one thing. Take one, we'll have a certain select service so that we have a better picture of the actual service.
Yeah, and I just wanted to point out too, for a lot of the eligible applicants, it was very general in the beginning, and we did try and be very specific in the eligible applicants category because we wanted to make sure that everybody could see themselves in these requests for application, right? Like I want, the mental health providers to be like, yes, I am an eligible applicant, so I really tried to do that. So we can do that better. Great. Yeah.
I think overall the applications were pretty clear. I only had an issue around the budget piece, which I think I emailed you guys, but I don't know if that's this section or the next section. That was the only piece that I found confusing was it seems redundant. And I do think you guys needed to review 2 things written in a slightly different manner, because that just is extra time. So that would be my just more clarification around what really is the budget plan, what is the budget summary, what is the budget narrative. I mean, it's just
Thanks for that.
Marcia Turner, there's something around the whole concept of telemedicine and the fact that there's a shortage of practitioners in rural areas. And is there an ability to have a person on the other side in one of the urban areas? There's that. I think we need to just understand that more and maybe just turn it upside down and look at it from different directions, because I think, even just as like, if we look at the hospitals and the availability of staffing for the hospitals, is there any way that they could have like virtual staff that could help them fill gaps? Regardless of, I mean, the person would have to be about it, but is there a way to look at that in a different way?
You know what? Sorry, answer, I'll get, this is actually a question for you, Gerald. I'm wondering if you think, based upon what Marcia was saying, if Project Echo is something that could be more expanded with regard to its reach and width, incorporated into what we're doing with RHT.
Gerald Backman. So I'd like to comment on both things. Yes, I do think so. Project Echo could do that. Having written now and been part of 5 rather large telemedicine funded applications, the piece that always falls apart is having enough urban providers to support the request. And it's usually that we have 1 or 2, people who are standing out in front, and if we lose one of those docs, then the whole thing falls apart. And I think, at least with that particular application, it is an answer, but I don't know that there are some health systems in the country that do a fantastic job at it. And so far, I will even say we have not hit that mark yet. It's always been provider, a very specific provider, and if you lose that provider, then it sits in a closet. You get a call 3 years later saying, do we want to keep this card? We need to get rid of it.
And sorry, it's Marcia Turner. And I'm wondering if the nursing students or masters, is there a workforce element that can help in the day-to-day stuff elevated to the whole span of practitioners that could look at? I'm just trying to brainstorm for the future. Because there's just not enough to go around, even in the urbans too.
Yeah, that's fair. I think, Marcia, to the point that you're making, there are other ways that we can address that also. I mean, for example, we just made recommendations for 8th round of GME funding, right? And going forward, maybe that's something we look at with regard to that RFP and say, look, if you want this money, you've got to, have some telehealth into rural community through various partnerships if you want to create this residency program. Or I don't know, I'm just saying it's because when I look at the applications, we got a lot of them said, we're going to use new telehealth. We're going to make sure that our residency program is good telehealth. We're going to telehealth. We're going to partner with rural on telehealth. It's like, okay, well, if we're going to do this and build year upon year upon year upon year of residents, and I'm hearing there are no providers that are going to be a component moving forward of the sustainability of that's a problem.
And Gerald, I think in some cases, it's not a lack of providers. It's a lack of willing providers to do the telemedicine because they're busy enough in their schedules that they've got a full deck. And if I'm going to see somebody in Tonopah using telemedicine, it takes away one of those slots. It's a patient visit, and if I have a full room, and I don't know what the answer is. Maybe we're in better shape in some things, and maybe one of the things that we need to do is reach out to our urban hospital networks and our urban providers and just find out where they're at again, because a lot's changed since the last round of telemedicine funds went out. Maybe there's some opportunities, but I think we need to get it. When I say we need to get a better handle on what the capacity is and what we're able to do.
Dr. Bailey, just to go off what Gerald said, there's, I'm sure, a lot of opportunities around telehealth, but it has to be an established, viable, consistent program, because you can't be setting up cardiology visits for your patients and then have it just canceled. Not doing it anymore. I think that's what Gerald's getting to.
Yeah.
You don't want to establish this program for your patients and then
have it fall apart because your patients are gonna blame that hospital over that clinic.
And this is Marcia. The other thing too is the whole remote patient monitoring. That is a great way to manage by exception and track a whole bunch of people and then have algorithms that flag when they need to be elevated. So there's other technology systems to help manage the flow and then, but also make sure that the patients who need to be seeing the practitioner are getting it, and which level practitioner. But I cut you off.
Sorry,
So go ahead.
that's okay. Amber Danelli for the record. I mean, the other piece of that, I know we have a tendency to focus on physicians, but that's where like we have the rural community paramedic. And that's where they can go in and help with all of those pieces of the telemedicine. The other piece is the University of Utah, of course, is super close to like us. They're in Elko. And so they already do a lot of the virtual visits like that, where there starts to be a complication just because I have dad who's 75. So he can have so many virtual visits and then he has to have a physical live visit in Utah. And then the other piece, even using the out of state, is that you have to find licensed physicians that are licensed in both states. And so while University of Utah has a handful of them, it's not enough for us to pull even from our outside network, even though it's closer than say Reno. So it does come back down to the physician piece of like ultimately adding in those support services like PAs or practitioners. Because in the state of Nevada, after 3,000 hours, his practitioners can practice independently. So they are a really good resource. I think that's just adding in that EMS component of the rural paramedic to go and check on those different virtual patients that also, all of a sudden need to be monitored because something on their, patient monitoring, that we have patients on monitoring all over in rural Nevada that are on a cardiac unit or on a cardiac monitor, or some sort of monitoring or OB, same thing. And what happens ultimately is that they have to call 911 and then the ambulance has to go out. And so there's a better way to do that, I think, using community paramedicine.
And Daryl, I just want to point out to our president, I did say the miters and position. So, because we do have that
Yeah,
capacity
that's
too.
right.
Yeah. So, I need to be this position.
So if we could just jump back to the next slide. And some of this was covered already by, you guys have already given some info, but I just want to make sure we don't miss anything on the clarity of expectations, right? We were tried to be very strict on who could apply. And who couldn't. I know there was some confusion regarding universities on one of the applications, but we got that clarified. And then the secondly is on the scoring matrices. Did everybody feel like those were clear enough that you understood how you were going to be scored against this, or any thoughts or about those items?
Just a quick question, are the applicants going to get their scores back?
If they request them, then we're not giving them the scores, but we are giving them the feedback.
Okay, because I think that question depends on them getting that feedback and then they'll let us know, if that matched their expectations. I did have a question too on letters of commitment. I think sometimes you're getting letters of commitment, but you're also getting letters of support. And so I was wondering if we could add a little language in the future applications to delineate those two. And it seems to me if you're a rural provider or a clinic applying, you don't need the letters of commitment, but there's a question that's been raised. If you have letters from other community entities, is that helpful? Does that maybe boost you up against somebody else in any way?
I think that is an area that we could absolutely clarify going forward, because this is part of our evaluation committee discussion. Right, they have lots of letters of support, even though they didn't know it would get strengthened, so we need to make sure that we explain if it's going to strengthen or not.
Yeah.
And Gerald, actually, now that we have more time, one of the things that, at least in this next round of applications, that you might want to think about doing is that instead of letters of support and commitment, you actually have a memorandum of understanding between that they could sign with everybody, what everybody's expectations are, and do all those types of things in lieu of those letters of commitment and support. And then a lot of grants that we do actually give points for being able to do that. If it's put together with, so. I'd be an opportunity.
We had some folks that didn't want to do the MOU until they didn't want to commit.
Well, but
We're
you
willing to
can,
commit if
you
funded.
can always say
But I
that
think-
in concept, you know, in concept, you just put that at the very first, if we agree, if funded,
This would be.
but, yeah.
Noel Schneider, and I think, if I remember correctly, part of the discussion around MOUs was it was such a short turnaround, so
Yeah.
that might be hard to get done. So entities that require multiple approval processes before signing an MOU, and sending it around to a dozen partners can take a minute. So those DocuSigns aren't as quick as we think they are. But, you know, looking at expectations, one area that I heard some feedback on was going back to that budget and even both the, apparent like duplicity of it and then the really high, it seemed to be quite a high percentage of your overall score in the grant for budget, especially when it's gonna go back out to budget negotiations. So, you know, both it, we're kind of like two budgets almost that were required in some ways or two different manners, and then it really accounted for quite a significant part of that application. So that would be some feedback that I had more specifically, and then, you know, continuing even as we have these conversations here and looking at boundaries as to, and clarity as to around who can apply. And even our conversations here have been a lot around physical health and primary care and not around behavioral health. Even that, as when I work with schools like that tier 1 level, like how do we, as a population, make sure we have a really healthy population? Because we know we have a lot of these shortages and we're probably not gonna meet these shortages necessarily in 5 years. We're gonna get on track to like start meeting them, but what other things can we put into place as a population level support with this funding piece we continue to look at?
That's fair. Building on that point, and this would be a question for our educators. I think, or I would ask, do you think it would be helpful if the applicant community knew what programs at the Great Basin, anything under the NSHE moniker were available to be utilized, whether online or however that could work, such that they know, oh, and we can pair this with the CNA training or the online, you know, whatever. But the point is that people know, okay, these are the programs that, you know, we feel we have the capacity and readiness to push, you know, into the rural communities that can help. You know, because a lot of what I get is, you know, the workforce is really hard to get, but that doesn't mean that there aren't people already there that are willing to do these programs, but they don't have the access in some instances. So I'm wondering, is there a cross-pollination opportunity there too?
So Amber Dinelli, for the record, we built a working group with all the universities and all the other community colleges. We put a spreadsheet together about all the things that we offered because we also didn't want overlap where someone was like, oh, hey, we need to go offer a nursing program in Elko, and it's like, done that. We have, you know, and so we didn't want overlap. There's things that aren't provided. And so we kind of shared that out with everybody. We can do, like, if there's a possibility of sharing that with you guys, so you can put that on your web site, that would also probably be helpful. But I know that there wasn't, any of us that didn't, you know, try and connect or meet with different entities across rural Nevada. But I think just taking it one step further would be making sure that that information is also readily available on your guys' website.
And Marcia Turner, we'd be happy in the interim to help with that matchmaking, speed dating, whatever that looks like, to just help get the word out of what we're doing. We have 205 different health sciences degree and certificate programs. Almost every flavor. We do have some missing pieces, and they're throughout the whole state. And so it's good to know, to have the community know what we offer, but it's also, you know, good for us to know who needs what, because it might be, you know, what kind of deliveries mechanism, which school can do it.
And the other thing, Amber Daniele for the record, sorry, but the other piece of that is there is additional funding sources coming through too, like SB 165 from Senator Wynn, and it's a bill that specifically went to UNR, UNLV, and Great Basin College to build out behavioral health and wellness degrees as a practitioner, and so that's coming too. But it would be helpful if all of our communities knew that that is also on the horizon. So just being able to share that there are other funding sources as well that are expanding these educational opportunities that might fit nicely with something that somebody else is planning. So it helps us as well.
Shayla Holmes for the record, as a once upon a time full-time grant writer, it concerns me to think, and then it hit me like a ton of bricks in this conversation, that there are people submitting applications that haven't done their due diligence to actually say, I'm gonna build a nursing program, but not go find out if there's a nursing program, right? And I'm like, wow, that is a real possibility. But I think it's a near impossibility to try to educate the entire state of what is at play, what is being worked on, what has been funded, to narrow that down. I think it would be easier in the application process to put that onus on the applicant, and a question like, what other services are in your area along this line, put something in there to make them have to address the research component, and identify that it's a true need. There's a need statement, right? But then we end up with some of these generic things, depending on who's on your review committee, may or may not have all of that awareness, because that's also really hard to build out in a review committee. So I think putting something in that application to put that onus back on the applicant might be the best way to figure that out.
And Amber Daniele for the record, the other thing that like even for us in these small communities, I mean, Humboldt General can only take so many nursing students. Northeastern Nevada Regional Hospital in Elko can only take so many. We have a nursing program in Pahrump. They can only take, and same thing with Western Nevada Community College there in Fallon and Carson. And so some of these hospitals that are smaller, it's not like if you build it, they will come. It's like the population is what it is, and what we can expand will be expanded on. But I 100% agree with the things that you're saying, and then helping out other communities like Tonopah and Esmeralda were other things that we chose to do as an institution to make sure that you guys had accessibility and an opportunity to submit. And so I would just say I appreciate the fact that you guys also considered. I mean, I hadn't met you before until we had that meeting here, and just knowing how small these communities are and that they don't have grant writers. I think the other piece is just making sure that maybe on the website that here are some of the additional grant writers or people that can help out write these grants, because some of these rural areas like Beatty might not even know that there are resources for specific grant writers in the state of Nevada that can assist.
They do now.
So
That's your lady in Elko.
yeah. Except that like literally, I mean, the other side of that is just, she's one entity, and right, we're happy to help out where we could. It really limits how many applications, and so we don't want small places like Beatty to miss out, or to even just have, even if they had a clinic that popped up, that somebody could see a provider, every other week or something like that, or you add telemedicine in. But all of those applications, like just as long as they know that there's a resource to help write that.
I have one. I just gotta say thank you, because when we first met in that first meeting, I come in here and I thought, oh my God, what have I got myself into? And how am I gonna do this? And I had made mention that there's like not 100 grant writers running around. And Amber said, I'll talk to you after the meeting. And that kind of sparked the whole thing. They got a great group, and I'm glad to be associated with you guys. But I put together a little, like, I guess it's a focus group, but it was Great Basin, Nye County School District and their grant team, Tonopah High School, because all the kids in Esmeralda go to Tonopah High School. And I wanted Beatty to be in, but they couldn't be in on that meeting, and myself, and then Stacy Weeks. But we're all trying to get together and come up with a program for our school where we can start initiating the dual credit And after that first meeting, I backed away because like too many cooks spoiled the stew, and there was about 10 people in the meeting. They broke it down to about I guess about 4 people are going to be in that meeting, and they're trying to come up with a program for the school. And I think my thought is if we can build them young and they already live in Tonopah, if we could get in 5 years, 3 people to graduate from Tonopah High School, going through that program and then move back home with a nursing degree that takes care of our clinic for 30 years. And so that's what our goal is to try and get some homegrown nurses. So, or doctors, or even better, brain surgeon or something, but
Yes,
that's
talk
kind of
to
the-
Gerald about the doctors now.
But, and anyways, that's like, we're trying to hit a couple of different ways, but we didn't want to go after everything on the first year. So wanted to get our clinic open, and now we're going to work on some other things and try and spread things out and, like I say, grow your own.
Taking off with that, Noel Schneider, wondering if as this process gets strengthened, there's just a resource of people who would be willing to help write support grants for those who, you want about a grants lab, the others looking about a community foundation, in United Ways, coalitions are willing to do that. So maybe that would be some sort of an opportunity to help with that process, but not seeing you all.
Yeah, and we can put it on our website, grant resource, like a resource page.
Yeah.
And here's a contact.
People who might be good resources.
It's been on my list of things.
Okay.
Perfect. Can we go to the next?
Yeah, let's go to the next slide.
I can't.
I can share something, but not.
There we go.
So the
At
next
the
one is.
very end, I'll share it.
So, and I think again, some of this we've already covered, but is there anything regarding the applicant experience for those of you that had to navigate the process? What elements of the mechanism of worked and what didn't work? We do anticipate by budget period 2 having electronic submission where you'll just hit, and it will take your application to submit. You won't have to upload it to an email. We are looking for a technology solution to make that happen.
Just don't use wrong.
Don't use wrong. Okay, good to know. Yeah. I agree. No. Not on our list that we're looking at, so you're.
Probably did fix some.
The only feedback that I had on the application, those who received and those that did not, if you submitted multiple applications, be helpful if it said your application for whatever you submitted was not accepted rather than just a blanket letter, because then people were calling saying, hey, I got this blanket letter, but we submitted 3. Do you know, is it on 3? And I was like, I don't
Tina's
know.
already, the fix will be when you submit an application next time, you will get an application number for each application. You'll be assigned a number, and every communication will have that number or you related to that application. So yes, that was the first thing the team.
Or like if they were
identified,
awarded.
because they're the ones trying to
same
answer the
thing.
questions.
Like,
Yes.
what were we awarded?
Yes, we will be assigning numbers, so each application will have its own number, so you'll know when you get the denial or approval, which one it's related to.
Nancy Bone, I guess my question would be to you guys, what do you need? And like, what did you find, could be helpful in the future?
Number 1, a technology solution to streamline the process, right? Where you can fill it out online and hit submit, and it goes into our system, and we don't have to copy paste, right? Type things in, that kind of stuff is our number 1 desire. I think that would cut back a lot of the extra time that we had.
You put the budget in online, all that stuff, that makes it a lot easier for you.
Every document, moving it from one folder to the other, document, to be that, it was a lot of manual time and effort that would go away with.
Yeah, we're just to follow up that, concern. All 50 states are doing this. Is there a front runner as far as technology solution?
Not that, I mean, we've reached out to our sister agencies to see what they've used, and they've given us demonstrations of what they're already using, which makes it an easier process to procure because there's already a contract with them. But every state's been struggling. It's always fascinated me in my 25 years. There's never been like an ideal grant solution system. Nobody's ever figured that out. And everybody, like every other vendor,
I'm like,
they can all promise they can do it.
Yeah.
It's no different than any other vendor, right? They promise they can do it, and then that just doesn't. live up to its expectations. So there is no front runner. It's just the
NMR system.
Yeah. Exactly. Okay, we can go on to the next slide, guys. We've talked a lot about this, but is there anything else as we look forward to future rounds throughout this 5 years that we can do to support applicants during the process? And you guys have given us a whole list of great ideas. And then again, what is the best way that we can keep the public and rural partners informed about the impact of projects, right, that are funded? So as these projects roll out and we're getting the reporting data, what are some ideas that you think would be important for us to put back out to the community to make sure they understand what's happening in their community and how these funds are being spent to improve services?
Shayla Holmes for the record. I would say that the majority of the community does not pay attention to any of the communication coming out from the government entity. So I mean, anything you guys put out there on the website will be aware, but will your community be aware? Probably not. I think the best way that we have found to communicate to our community, like what that looks like, is like requiring paid for by Rural Health Transformation Fund.
Yeah.
Like you've got to put that on the requirement of the funded agency, that like at a minimum, that tagline goes on whatever project they're doing, whatever communication about that project they're doing, if they're putting marketing out, if they have, you know, I know construction, like new construction's not a thing, but if there's any remodels happening or anything like that, I think requiring a tagline brought to you by Rural Health Transformation Funds, like that's gonna be the best way.
It's done. Oh, so, sorry, Dan, sorry.
Oh, no, I was just agreeing. I think that's a great idea.
Yeah, I agree. Because they do that with federal grants. You have to put,
We have to do that.
yeah, so federal money, I would imagine somewhere in the fine print it might talk about it, but I think that's.
Put that in large letters.
Yeah.
Sticker on that MRI machine.
Yo. Engraved. Can't peel it off.
Black.
Joe Westerland, even in the clinics, there should be something on the wall, you know. This clinic is sponsored by or provided funding by or whatever. They require it, like getting ready to do an opening for a park we did. And they're requiring us putting a minimum of, I believe, 3 signs on the park. And it talks about what they have done. And for the amount of money they give you, that's the least I think you can do for the group to give you the money. I think those are great ideas. Just, and people sit in a clinic and have nothing else to do but read what's on the walls, read their little books and stuff. So you'll get the information out that way.
One other thing that Marcia Turner, for the record, actually 2 things. One has already been said about the idea that if you have an issue or an opportunity where it's kind of in more than one grant application, either help navigating that or some bridge funding or some combo, something around that. And I'm sure everybody's willing to help brainstorm around that. But that was something that is hard to pick one or the other when it really is both. And then in the workforce categories, the service requirements for the educational piece, not the workforce, not like they're hiring a doctor who's going to work and have a contract for multiple years. If it's 1-year funding for a scholarship, and this, I realize this is on the federal side, but there's sort of a nuance too. Like, what if it's just a certificate program and they have to go 5 years back for, you know, so there's some nuances around that make it really difficult to really optimize that. And so I think that would be good to talk more about that.
I'll respond. Record. I like some of those ideas, but for travel communities and the small ones we have, kind of more promotional material, even video stuff that we can put up at our clinics. Sign stuff are funded by that, our people don't pay attention to that at all. So they want to see something more tangible. One thing that when we worked with the Silver State Health Insurance Exchange, they developed more stuff specific to the tribal communities that they could hand out and stuff, just little brochures and stuff like that. That seems to get the more acknowledgement than anything else, or even stuff we can post on our clinics and on videos, like some of the successful projects that went out. So.
And Amber Danieli, for the record, I know several of the projects or things that we build out have multiple, sometimes we have a private donor, federal money, we got GoAid. And we got a respiratory therapy program out of 3, you know what I mean? And so as you guys are looking at your applications, it's different for us to only be like sole sourcing something. And so maybe one of the boxes or one of the things that you have on there is also just something that says, do you have an opportunity for a private donor, or do you have committed funds from a private donor? Because that bucket that only had 35 million in it might have had something for 2 million, but they had a supporting source of another 2 million, but you guys didn't know that there's a supporting source of additional 2 million or something like that. But just because we use multiple sources, that might be something that you guys would want to consider as well.
And we probably kind of already went past this, but I think what I spent most of my my life doing is doing calls between people to try to get them linked and try to get their ideas developed and telling them, no, this is not a good idea right now because it's not going to happen in 20 days. I don't know if any of those technical new people you're hiring or some of those technical assistance people that can just get them to the point. They don't need a grant writer yet. They need a conceptual person to help them put it together. And we're supposed to do that as the State Office of Rural Health, which is fine, but our workload's gone up 100-fold. But, you know, I think that's where most of our people are at. They're not even at the grant stage yet of how to put it together. They're at, can we pull something together that's going to be cohesive enough, that we have the components enough to get us to a point where we can actually put an application in that's going to be competitive. So are some of those positions you're looking at, those types of folks?
Potentially that could be the TA center that we
Okay.
they could probably help us with that. Yeah.
Michelle Sandoval. So when we were talking about like what went well, everybody said that like the webinars, right, went really well. So maybe do a webinar periodically to let the public know like how these projects are going and what the impact's been. Maybe invite a couple of the projects to do a presentation or something, because that seemed to go really well. Maybe a lot of
That's nice.
pictures.
Yeah.
Pictures.
Words, sounds, and words.
Yeah.
Right. Not words.
Yeah.
Well, Shanae, I also was thinking about how competitive people are. It can be challenging sometimes to get some of our rural counties or communities to even see that they have a space in there. So if there's a way to take advantage, but use that competitiveness to our advantage to get more applications and more people to see that they can apply. You know, maybe it's by like $1 amount per focus area or per county, or to see that there is opportunity that, you know, Esmeralda County has been awarded funds, so there is opportunity for Lincoln County to like, and I'm just throwing out random examples, but they're like, oh, how'd you do that, Esmeralda? Like, you got something we didn't think any of us could, right? So you know, just some other, just the way it's marketed.
One thing, especially with rural, small communities, the rural communities, community gathering where you bring people out might be a good forum too. We did the state plan amendment for the pharmacy. If you remember that, we had a big chocolate gala and there was so many people that showed up. So those kind of forums where you get people to come out might be, especially in these rural urban areas, you can't do that, but the more rural areas, you can probably do that easy.
Yeah.
You guys have all the feedback you feel like you can do.
Well, we still have a whole section on what didn't go well.
I know, right?
I think we
Yeah,
got it.
I
We
thought
might
that
be
was
able to
it.
skip some of that.
I feel like you covered.
Yeah, we basically did.
I think we did too.
Unless
Yeah,
anybody
we
has
really,
something
really
else they
appreciate
are wholeheartedly wanting to.
Yeah.
I know, we kind of did both at the same
it.
time there, so.
Yeah, we really appreciate honestly the input. It's very helpful.
Yeah. Ms. Marshall, is there anything else we could have done differently that would have made optimizing the goals better? Is there anything missing, or, and as over the next year, I think there's an opportunity to talk about that and you can provide guidance.
I don't know. Other than just helping us spread the word, right? But if we create some materials that can help spread the word, I think that would be, yeah, but I think.
And Marcia Turner again, through NSU, we have a lot of different opportunities. We have a Regions Health Sciences Committee. Last 2 meetings, I've given updates and we can talk to you guys about the website and other opportunities to help people with that.
No, Shane, that was gonna be my kind of question and comment too, is how else do we support getting the word out, even about like award notifications, things of that nature, spreading it out within our networks and communities, because as someone shared earlier, that's was a big part of why we're here. That was my impression as well, so sure.
Becky Bailey for the record. I just had a couple other things to add. If we could just get some better clarification on what happens after they get the letter of intent. Because I'm getting a lot of questions like, do I start spending money now, or, you know, what's gonna happen? And I know that's kind of pending.
Yeah.
And some things have to go through CMS. But there's just like a kind of an official email about that or something. Also, if places are putting in multiple applications, if there was a clear way to indicate which one of their applications was a priority for them, would be helpful.
I just want to list investigation.
Right. And then are you guys looking at, like certificate of need process? You're getting some of these things, like if somebody has an application in, do they have to know whether they would have to go through the CON process? I feel like I don't think we added that to be considered.
Yeah, this is deep. So this has come up. I think this is something we have to think about for the contractor. We say in there, if their certificate need approved, then the funding would revert, go to the applicants. So I need to get that process started very quickly. But yeah, we have to still follow that part of state law. We have no exemption. And that's with us too now. So the good news is it's still with us. It's not like we could go to another agency, but, and it's with Allison. So we should probably go through everything that's been funded and see if we see any, you know, anything like clinic is one. Yeah, we should get the process. It's pretty quick.
So, Sean, just one thing, and you said you're going to be an electronic process for next year. We'll have to worry about the one. I think only my grant writer said was some of the forms, the Excel forms were just, they didn't calculate right, or there wasn't enough space to put stuff. So going to that electronic format, that'd be great.
Yes, did you have something else? Okay. All right. Good. I think we can wrap up that one.
Number 7, which is the RHT program non-competitive continuation application.
Okay. Another informational presentation for you all. So I'll pass it to Dina to get us started. Sharing, it's not sharing. Why is it not sharing? Bam. That's my fault.
And turn the right button.
So as you all know, we have non-compete continuation application due here in August. We have been working with CMS to try to understand what that looks like. One thing they have told us is there's guidance coming. And so we are anxiously awaiting that guidance and hope it's here in time for us to actually use it. So we're going to talk through this. We're going to talk about some just key updates and what the process is going to look like on our behalf. And then some reporting requirements we'll go through as well. So what is a non-compete continuation application? This is really, we have to do this each year. And it is due 60 days before the end of the current budget period, which is October 30th. So we have to have our application to CMS by August 30th of this year.
You guys are really taking a vacation.
I know. Well, maybe September. And then we will be noticed, once we turn that application in, we will get our notice of award October 31st is the anticipated notice of award date for us for that, through that process. So if you want to go to the next slide, is this, you're taking over, or am I taking over?
Oh, you do this.
Okay, yeah, that's what I thought. So the guidance is coming soon. It is supposed to help us understand the submission time items, what the key due dates are, and instructions on how to complete the process. So anxiously awaiting that, but we are also still we're meeting at the end of this month as a team to go over what we think we need to do to revise and what works in our application process and what we need to tweak a little bit. And I think one of the things to keep in mind is year one, we were on a call with CMS today and it made me feel better, was reminding us that year one report is due, our annual report that helps us with this funding for this year two. It's a check, what do they call it? Checkpoint process. So did we do governance structure? Did we get money out the door? Did we, so for year one, it's not our measures and our metrics. It's about, did we establish our governance structure? Did we get money out the door? Did we meet the goals? Did we do our plans that we promised to do? Those types of things. It's more, did we hire the staff that we said we were going to hire? So it's more of the administrative activities that we've been able to do. And we've been doing a great job of that and keeping up. So it gave me a little breather today when they were explaining that. So for year one, there's no metrics that we have to do as far as health outcomes. And so it will be based on that. What did we get done? So we will be pushing forward at this current speed to make sure we meet all of our marks before August 30th.
Yeah, and Marcia Turner, what's paid by non-competing?
So that is because we are already awarded the grant, right, as a state. So it's not the same process as we would have gone through in the initial process. I mean, it's very similar. There's still a lot required, but you're not in that same competitive nature. So you've already established.
So state to state,
It's very similar, I would think, the way we're doing a 5-year project. If we fund you in year one, right, year two is based on your number one, your performance.
Yeah.
And meeting your marks to get to your year two budget. Same idea.
So does the number that the state receives change every year?
It can, yes.
It may.
Like if another state does it.
So some states
Doesn't
do.
do what they're doing against.
They didn't get any money out the door. They may not be given as much, and so they'll take that money and reallocate it to the other states.
Yeah, we'll go over that. All right. So now we just want to give you kind of an overview on the different reporting requirements that we are held to, that we are also going to hold our sub-recipients to. And then rescoring and progress monitoring that we have to go through with CMS. So basically, to remain eligible, right, we have to adhere to these reporting requirements. We have annual reports and quarterly reports that are due. It's kind of interesting because the way that the Rural Health Transformation Grant rolled out, our first report is an annual report, not a quarterly report. So we will be, just talking about the cumulative impact that we have seen this year, and then reporting on our milestones and all of that. And then our first quarterly report, I think, is due in November, possibly. I have the date here later, so I'll clarify. But basically, the quarterly reports are more of that tactical tool for short-term monitoring and just making some mid-course adjustments if you need to throughout the project period. So basically, this reporting gives valuable information to CMS, of course, because it shows how we're doing as a state in, getting these funds out, but also the impact that we're having to the population that we're serving. So all of our sub-recipients, it's extremely important when, you do the reporting that you monitor, the lives that you're touching with these funds, right? What is the actual story, the impact that you're having in rural Nevada as a result of these funds? And how can we tell that story to CMS? And then CMS, tells that story to the federal government. So, all good stuff. So just talking about the annual reporting, basically our first annual report is due 60 days before the end of our current budget period. So as noted here, that is August 30th. Very exciting date for us to submit that report. And then I just included the next 2 years. Of course, there's annual reports for years 4 and 5 as well, but it just didn't fit so nice on the slide. So I didn't put it on there. But yeah. The quarterly reports, of course, those include, our progress on the milestones, any type of technical assistance requests that we have as we're going through the project period. Dina mentioned we have our bi-weekly meetings with CMS, and so that's super helpful because, we can just kind of like, I guess, what is it, like storyboard our, questions and things with them, and they can kind of give us guidance on, where we should go. And then they also give us official guidance on those calls for things that are upcoming, just like the NCC application where, she's talking about potentially that being coming out next week, but no official date yet. So we'll see. But yeah, so the first due date there is November 29th, 2026. So that's when our first quarterly report will be due. And then keep in mind too, that with our subrecipients, we have to kind of back into these dates. And so we will have quarterly reporting due dates for our subrecipients and annual reporting due dates that will be approximately 30 days before the state's deadline to get that reported to the federal government. And then it's nice CMS to give us a break with our fourth quarterly report, and like we can just submit the annual report for that. So good to go. So rescoring. So we talked a little bit about this in our first meeting about how states are held to these different scores that equate to different dollar amounts that are awarded to the states based upon how well they do in implementing these different initiatives or state policy action. So we did include a few state policy actions that we committed to in our application, and we were awarded funds in support of meeting that goal. So every budget period, those are recalculated based upon the progress that we've reported on meeting those state policy actions. And then also the initiative-based factors and how we're progressing towards that. So the checkpoint model is used to monitor our initiative progress across the state. So the checkpoints there, they include your milestones, your metrics, your reporting, a whole bunch of things are included in those checkpoints that we have to report back to CMS. And then we also have to submit evidence of how we've actually met that checkpoint. So, depending on the checkpoint, the evidence will be different, but we do have to include all the evidence to CMS on that. Then with state policy actions, we can attest to the advancements made there. And we also can include supporting evidence such as, press releases or maybe a new website was developed or a new BDR was introduced, just different supporting evidence such as that. And then, of course, if we decide to, oh, this was actually a really good state policy action, we didn't put that in our application, but we really want to do it. Well, we don't get credit for it if we really want to do it. So we had to put it in our initial application. So that's kind of why we put those in our initial application to, the ones that were, most feasible for the state to pursue. So that's what we did. And then looking at the initiative progress reporting. So again, our checkpoint model helps to reduce that subjectivity and progress determination rate. So a lot of times you're having a lot of narrative that supports, your progress made toward a goal, but then also looking at like what actual documentation exists for that, and if you're able to support that in a justifiable way. And then, of course, that also standardizes the treatment of the stages for each state. So each state has to make progress towards their initiative-based score factors in a stepwise fashion. Like you can't move on to the next stage until you've completed all the checkpoints in the first stage. And I think my next slide will go into that a little bit more. But there's stages 0 through 5. So stage 0 is like, the baby phase of getting things started going. And then stage 5 would be like you're completely implemented fully. And let's see, what else do I want to talk about there? I think that's about it. And of course, you have to have the evidence of completion at each checkpoint to support that progress made. Yes, here's my table. Okay, so as you can see, we have different stages that we have to progress towards and through. So stage 0 is planning phase, establishing that governance, submitting your project plan to CMS for each of our initiatives. So each of our initiatives have to have a project plan for how we intend to, complete those initiatives and what success looks like for each initiative. And then, you just move along through our little stages. So when we put together our application, we had to provide bullet points, if you will, for each of the stages on, what the state felt were appropriate activities to note completion at each stage to move on to the next stage. And so those are all included in our project narrative that's online. So if you guys want to go peruse that, but it is all there. So this is kind of what will be held to with CMS. Of course, it's not like final of the reporting that will be included just because CMS has to go through all of their, I think it's like the Paperwork Reduction Act or something. They have to get a public comment and all that good stuff. So still not final, but will be similar. Let's see, state reported data forms. So here we have different forms that we have to complete to show our progress. So we'll have our initiative progress that we'll update, including a narrative, values with the metrics that we had submitted in our application, and again, the number of people served, so very important. And then if you'll notice down at the bottom is success stories, right? So that, again, it's super important to have those success stories from our program implementation and, how it impacts our rural Nevada. And then not all of these data elements are required in all of the reports, but they are all required in the annual report. So we'll be working diligently on getting those completed by the August 30th deadline. And yeah, I think that's what I wanted to say there. Oh yes, determine scoring. So the two things, the initiative checkpoints and state policy action commitments, depending on how well we do there, we could potentially be awarded more points, which is awarded more dollars to the state. So always looking to, move forward on both of those things. And then here I just wanted to show a timeline for, our reporting. And if you'll notice down here, so the rescoring, right? So we have our first annual report is due August 30th. CMS takes the information in that annual report to do the rescoring process and evaluate us on all the things that I just mentioned. And then the states that aren't doing so well, they will take those funds and then distribute them to other states on their, magic calculator that I don't know the funding formula for, but it will all get redistributed to states who are performing well, which hopefully will be us. Well, it will be us actually. And then, so they do that every year. They will do a rescoring based upon progress noted in the annual report. So what are we expecting from our subrecipients? So of course, we're expecting basically the same thing that CMS expects from us, right? So we're looking to have active partnerships with our subrecipients. We really want to communicate with them. We're going to host kickoff calls with all of our subrecipients and just be that, TA center for them as they move along in their projects and reporting. We're putting together right now reporting templates. So it'll be easy for subrecipients to just, plug and play and plug in the metrics that they need to report on, plug in, where to put a narrative or success stories or things like that. So just trying to make it as easy as possible to report back to us because we know that it is intense. And then also we're going to be conducting our oversight and management to ensure that that the subrecipients comply with all the federal terms and conditions, including the reporting. We will be doing site visits with our subrecipients. So as you can imagine, there's been a lot of activity this year in just setting up the RFA process, evaluating the subaward or the applications, and then developing the subawards. Next year, that's going to be layered on top of doing site visits and technical assistance with the subrecipients and all that. So it's going to be a lot. Yes, Vance.
Vance Farrell. Melinda, I know that you just mentioned that site visit that Health Authority will be doing. Has CMS hinted or indicated any interest in doing their own local site visits or site visits in tandem with the Health Authority site visits?
What's that in here? I'm trying to remember. Oh my gosh. Okay, so I think don't think I put it in this one, but okay. So yes, we had a federal site visit with CMS this year already. We were one of the first states. They asked if we wanted to be one of the first states that they visited, and we said, yes, please come to Nevada. So they did. Our project officers are based in Washington, or state of Washington, not Washington, DC. So they came and we had basically an in-office visit one day where we talked about, you know, our reporting metrics and what the initiatives that we're doing, and just we also had Nevada Rural Hospital Partners came, and also Nevada Primary Care Association, just to provide a comment on, you know, their areas. And then the next day we did a field trip. So we took them to Rural Nevada Counseling in Burnley. Oh my gosh, I don't know why I couldn't think of that. We also went to Pyramid Lake Tribal Health Clinic. So, and then we went to Pershing General Hospital. So we fit all that in one day with CMS. Wow. Yeah, it was really awesome. And, you know, got to show them around our state. So they will come annually. Next year, we're thinking about, you know, doing Southern Nevada and going around rural Southern Nevada. So, and then, you know, we'll get different regions of our state, get to where we can cover the whole state with them. So we're looking forward to that. Good question. Thank you.
Helicopter to your next section. And then Amber Dealing for the record. The other thing is just the planning and the reporting. Obviously, you guys are still working through that, but the sooner those entities that were awarded have a better idea about what it is they're going to be reporting on, so that they can start collecting that data and that information sooner rather than later. It makes it easier for the reporting.
Yeah, thanks for bringing that up. We're trying to be extremely clear about that in our subaward. So once we do have an executed subaward with the subrecipient, we will be sending them basically a packet. So we'll have, you know, all of the, like the subaward, it will have the request for reimbursement workbook with the instructions, and then of course the reporting templates. And so, yeah, just hoping to have that be very comprehensive for folks.
We're supposed to be
clear.
We're submitting to CMS next week. So we should have an idea of what we submit as far as our reporting, and we're going to use that template to develop the subaward template. So the team's kind of clearing it so that it'd be good to our reporting.
Oh, and that was it. So we went to the end of the thing. All right. Any other questions on that?
Marcia, I think that success story thing is really exciting. And I think that, I don't know if it was a requirement, but it should be a request anyways, and be celebrated, and that can be part of the whole, like, get the word out.
Yeah.
Okay. And our next item is going to be next steps and timeline for 2026 and 2027.
I just wanted to share with you all the timeline graphic. We had updated it recently to show just some of the different pivots that we've made in the Rural Health Transformation Program. So basically, you know, before we had key dates for our RFPs to come out, right? And so now we're not doing RFPs, we're doing completely RFPs. So just wanted to, you know, highlight that we have done a lot of work already, and we have a lot of work ahead, but we're working with our Office of Analytics team to develop public-facing dashboards to report all of our RHT metrics. We obviously have formalized this steering committee, so we can check that box. And then we're working our way through hiring new staff for our Rural Health Transformation team. So looking forward to onboarding those new folks. Did a lot of workshops, right, in Q1. So that was really great. And then done a lot of, you know, we've published all of our RFAs for this budget period. So that is a huge feat in and of itself. And just wanted to note here that, we're working now on conducting those evaluations and scoring of the applications as those due dates kind of roll in. And then we'll be submitting those letters of intent to fund to folks that are chosen for awards. And we let every applicant know if they were or were not funded. So there will be communication either way. And let's see, I think the main thing that I want to note here too is that, for budget period 2, since we're expecting to get our notice of award around October 31st, because that's the first day of the budget period. So we would hope that we would get the notice of award that day. And we're looking to get those next round of RFAs out for budget period 2 as soon as January of 2027. So very aggressive timeline, but I think it's totally doable because we have an amazing team and we've got a lot of lessons learned that we can incorporate and just continue to make the process better as we move forward. So yeah, so I think that was all I wanted to highlight there. If you have any questions on any of that.
Questions on the timeline?
And this is really in the weeds, so Gerald, so we're gonna go in the weeds. So I think the one thing that concerns me is if funds have to be expended, and so equipment, and 50 states requesting equipment, and delays on ambulances already, is CMS working with everybody already on those ambulances that aren't going to be delivered in that fiscal period? And I just, for my own curiosity, and can't share yet, but
Yeah, no worries. It's a great question, Gerald, because I mean, it's been raised before, and we've actually asked CMS about this issue because we know that there are delays. And yeah, like you said, there's 50 states that were awarded these funds, and so there's going to be a lot of requests for ambulances or MRIs or CTs. So as of right now, CMS said that we are to communicate with them if we have any anticipated delays. So we're asking all of our subrecipients to notify us immediately if there is going to be a delay in any delivery of equipment, or if they have any inkling of a delay with delivery or being able to, fully pay that last invoice, right, that will be needed to expend the funds. So yeah, just communication right now. CMS hasn't said that they're going to budge on it.
I just was wondering, because that to me is a big piece of that one bucket.
Yeah. Yep. So right now we just have to be very communicative.
Okay.
Jim Holmes, I would just add that in some of the feedback I've seen for grants that haven't been approved, that was a part of the feedback, was concerns about procurement. So some folks that were denied in this first round and did get their feedback back, that was a component included. So I think your review team did a great job on taking that into consideration just for the website.
Anything else from anybody? So we'll move on to 9, which is any future agenda items that anybody would like to add.
Do I speak in this one or number 10?
You can go ahead, Dan.
Okay. So NRHP and the State Office of Rural Health have had some conversations about what we could do to maybe help. So so Blaine and I and Becky and staff have talked about our rural health day. It's coming up. We're expanding that to 2 days. So it'll be the third Thursday. I think it's the 19th and 20th of November, whatever that third Thursday is. One of the requests from the rural hospitals were a grant workshop. So we're putting that together as part of that. We would love to invite your team if you want to be part of that. And we actually are going to specifically, hopefully your applications aren't changing too much, because we would like them actually to bring the application with them and maybe walk them through the process of building that application and the budget and really focusing on that. And then the other piece is, I think one of the big frustrations we've had is all of these. I mean, I work for the university, but we have all these wonderful ideas at the university and nobody has a clue about what it is to do something in rural Nevada. And so we wanted to provide an opportunity for our rural hospital administrators and providers so we can put at least one session together where they're going to do the panel they're gonna talk about what their priorities are, what they got funded, and maybe what some of their new ideas are. And so we can start making those linkages for, and it's no disparagement among our faculty. They have some great ideas, but, you know, implementing them in Pershing County, Nevada may be a challenge. So, that's nothing against Pershing County, but got an idea this big, a facility that's this big is kind of a challenge. So those are a couple of the ideas. Be more than happy to, I think we said at our last Royal Conference, be happy to, if you'd like to do a session, maybe talk about what's going on. Hopefully we get a captive audience, but I think we've got some tools, and I've already had some people reach out as far as the Grant Friday Institute workshop over the 2 days. Have some staff that would like to participate in this and that. And it's not a conflict. And it's going to be held at the Joe, because we outgrew our last facility. So we've got, I think, the whole fourth floor. So we've got the whole fourth floor for those 2 days. So we have these. So share that. Hopefully that helps.
Yeah, that's
Okay.
great. Thank you. If I can just add on to that, this Marcia Turner. So one of the things, so the chancellor created this rural health transformation coordinating council, and Amber sits on it. We have the presidents of each of the schools appointed somebody. So we've got this system to try and help coordinate, and even within like disciplines or even within the schools, try and cross pollinate and let people know what somebody's good idea is and try and collaborate and encourage that. And we have had in this first round some really good ideas where people were very conservative. They said, we don't want to launch unless it's something we know we can do. We know we have the partner. We know we have the capacity. And I really respect that because, you know, there's so much money to go after, and I really am happy for that. And I think there have been some challenges in knowing what the true needs are and matching those up. And so I think that's something that we're going to work on. And I know we'll be working with you guys and anybody else, but if there are needs that in this first round, you're like, gosh, we could have had this back to that gap discussion. And like with corrections and the tribal community with the VA, like what are those entities need that any of us, you know, NG or anybody else can go after? And then, but I do appreciate that our folks were very careful about wanting to submit things that they could deliver on in the time frame, especially. And so that's why I was excited to see when the next rounds are coming, so that we got some work to do to try and marry those up. And so we welcome any feedback or any ideas or brainstorming opportunities. And I'll probably bug a lot of you guys about going the other direction, because you just never know what that magic thing's going to be. So.
And Gerald, again, and I think our biggest thing was, I mean, there are a few of us who delve in rural all the time, but this is an opportunity. I mean, I think it's one of the few opportunities. I had no clue about some of the stuff happening in Nevada. It's blown my mind. I mean, we had somebody have something on the space station, you know, that was telemedicine related. I didn't know, it's in my own university. But you know, I've got to know people. But you know, my thing is, you know, that relationship piece has got to happen organically now between some of those other colleges and between, and especially if it's hospital, clinic, community driven, you know, how do we get them in front of those people so that they can get a good idea about what, so if you have any ideas, the calls for proposals are out now, for sessions and presentation, please participate. And it's not shameless self-promotion. We're doing this program every year anyway, but hopefully do a little bit there. Help the goal.
Anybody else have anything that they don't feel like was covered? Or I think you guys did a pretty good job with the agenda. So any of the things that I think would have come up as questions or wanting to give feedback on, it really created an opportunity for a lot of discussions.
And then just so you know too, we do intend to, keep you updated at every quarter on, our progress forward when it comes to the funding and, programmatic updates and then, the reporting. So.
And then before we, sorry, go ahead.
Can I share one more? This has nothing to do with RSVP.
Anybody know Gerald? One more, Gerald.
So we're part of the Arizona Telemedicine Consortium that's funded through HRSA. And every 2 years, they come into a telemedicine conference. And when they contacted us this year, this was along with both John Packett and I thought, if I go to one more telemedicine conference, I'm gonna quit. So we actually asked them if we could do a simulation medicine conference. They did on that. And so September 11th, we're actually going to be bringing some folks in, Great Basin College, Orvis School of Nursing, the School of Medicine, a project out of Montana, just to talk about the use of simulation medicine and AI for rural training. It's going to be held up at the Lake Tahoe campus. I can't remember what the right name is. So we'll hold it up there. So I don't know if there's a way, if you want to share that, if people are interested in that, use of that technology, and it's free. So Arizona's doing all the labor. So please.
Right.
Now, so famously self-employed.
Okay, Bridget, for the record. Okay, so one additional thing, if you guys saw, we had the minutes from our last meeting that were in there, but we didn't get that on the agenda. And so that's going to circle back at our next meeting. We'll make sure that it's on the agenda. So we'll be approving both the last meeting and this meeting. But feel free to review them as they're in the packet. Okay, and with that, you want to read that public comment?
Sure. So public comments. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item, and comments will be limited to 3 minutes per person. With that, I'd like to call for any public comment.
Public comment noted in the boardroom. Is there any public comment online?
None.